President Joe Biden just signed a massive $1.7 trillion Omnibus appropriations bill that will have a positive impact on three major areas of retirement: the Social Security Administration, Medicare services at home, and the all-new Secure Act 2.0 that will include major enhancements that will affect all of our 401k and IRA accounts. And for those still working, stay tuned as we will discuss 9 items and how the Secure Act 2.0 will affect your retirement. Hi, I'm Chung.
And I'm Chung. Let's first discuss the Social Security Administration. The spending law includes $14.1 billion for the Social Security Administration, almost double the budget from the previous fiscal year. How does this affect you and others? Well, between 2010 and 2021, the Social Security Administration staff shrank by 15 to 25% nationwide. So there are fewer people to handle the appointments, answer phones, and process applications. As a result, workers and beneficiaries must wait longer to be served.
To your point, some of our customers that are not very tech savvy or have a certain situation need to call Social Security, and the average wait time has been around 30 minutes to almost an hour. Then when it comes to making an appointment to enroll in Medicare, it might even take 2 months to book an appointment.
Yes, that's a very big deal if you're trying to enroll in Medicare and your Medicare's effective date is in 2 or 3 months.
In addition to Social Security's own staff, they also fund the state disability employees who decide whether or not someone qualifies for Social Security disability insurance. The state's disability staff shrank by 16% nationwide between 2010 and 2021. As a matter of fact, all of these 8 states listed here lost over 30% of their disability staff.
Because of the lack of staff members and a backlog of applications, we've had disability applicants waiting months, if not up to 2 years, to get approved.
This extra $14 billion funding sounds like a lot, but it is only a 6% increase from the previous year. Let's hope that's enough money to serve all aging into Social Security and Medicare.
Regardless, at least we are going in the right direction. Now, before we discuss the money that will go towards Medicare at home services, let's first discuss how the spending bill will impact your retirement funds.
And that would be change number 2, the all-new Secure Act 2.0.
Now, not all of these will apply to you, so we will briefly touch on each point. Also remember, these changes just came about, so subscribe to our channel as we will go in depth on some of these changes and updates in our future videos. Oh, and please help our channel grow by clicking on the like button. And as a thank you, here's a picture of Gracie claiming her spot at the dinner table.
She always does. Maybe we have a bad habit of putting her on the dinner table. Yes, this part of the $1.7 trillion bill includes the Secure Act 2.0. The Secure Act stands for Setting Every Community Up for Retirement Enhancement Act. That's a mouthful. And this first enhancement went into law in January 2020. However, as of January 1st, 2023, the new law allows more individuals to reach their savings goal while working and provide more flexibility upon retirement. For example, in 2020, the first Secure Act stretched the RMD requirement from 70.5 to 72 years old. RMD is the required minimum distribution that you must take out of your tax-deferred retirement accounts, such as your 401k, IRA, 403b, and so forth.
Remember, the government gave you a loan and never taxed you on that money. So a minimum is required for you to take out so the government can finally tax you on that distribution as income.
Now, there are 9 major changes to this new Secure Act 2.0. The first change we will discuss in depth since this is the biggest change that affects most of us. So as not to bore you with the things that don't affect you, we will briefly list the other 8 items and leave a link below with more detail if you're interested in learning more. Okay, so change number 1. The new RMD age requirement changed again. The new RMD requirement for 2023 is 73 years old. So if you turn 72 this year, you might want to reconsider taking your RMD distribution and keep deferring your taxes until the following year.
Here's a chart that goes by your birth year. If you were born before July 1st, 1949, you should keep taking your RMDs as you've already had since you were 70.5. For those born on July 1st, 1949 through 1950, your RMDs will be age 72. If you have a 1951 to 1959 birth year, your new RMD age is now 73. And lastly, for those born in 1960 or later, your RMD age is now 75.
By the way, do you folks know what the largest IRS penalty is? It's failing to take out your RMDs. Currently, the penalty is a gigantic 50%. But starting in 2023, the steep penalty for failing to take your RMD will decrease to 25%. The penalty will be reduced to 10% if the IRA owner later takes out the required amount previously not taken and submits a corrected tax return in a timely manner. Now, additionally, Roth accounts and employer retirement plans will be exempt from the RMD requirements starting in 2024. And beginning immediately, for in-plan annuity payments that exceed the participant's RMD amount, the excess annuity payments can be applied to that year's RMD. Now, I know that all of this may seem like a lot to digest, but give us a call if you would like to get more details.
Now here's a list of the other 8 major changes. If any of these subjects appeal to you, please see the link below. And while Secure 2.0 provides increased opportunities to save for retirement, everyone's financial situation is different. As always, consult your financial advisor or tax professional to understand how the Secure 2.0 changes apply to you. We do plan on making future videos on how this new Secure Act could impact retirement planning strategies.
So how does the new Omnibus Appropriation Act affect Medicare? The budget package extends several pandemic-era provisions for people on Medicare. These provisions will help many older retirees access medical care more easily.
The first one is telehealth. The spending package will extend for 2 years until the end of 2024.
Before the coronavirus hit, Medicare coverage for telehealth was scarce, available mainly to people in rural areas. When COVID hit and shelter-in-place started in March of 2020, these virtual visits were made available to all Medicare beneficiaries. In addition, Medicare expanded these types of providers that could get paid for telehealth sessions, enabling nurse practitioners, clinical psychologists, social workers to see Medicare patients remotely.
That's true. Before the pandemic, telehealth visits had to include video, which made it difficult for some beneficiaries with limited or no broadband access. The telehealth changes in the spending law will also allow Medicare enrollees to have remote visits either via video or telephone. But again, this is only available for the next 2 years.
Yeah, just 2 years, folks, sorry. Now here's the next change. Have any of you heard of hospital at home? Well, this new bill will extend a decision by Medicare to allow hospitals to treat some patients, including some who would ordinarily be seen in emergency rooms, in their homes instead of admitting them to a hospital.
I'm sure all of us remember in 2020, COVID cases were flooding the nation's hospitals. So in November of 2020, there was a new plan to free up hospital bed space and protect older Americans from being exposed to the virus. Under the spending package, this hospital at-home expansion will continue through the end of 2024.
The spending package also includes behavioral health. Beginning in 2024, Medicare will increase the number of types of providers the program covers to treat behavioral and mental health disorders. In addition to reimbursing marriage and family therapists and licensed professional counselors, the spending measures provide coverage for intensive outpatient behavioral health services as well. Yes, good changes are coming out of this $1.7 trillion bill.
$1.7 trillion. Where is the government going to get this money?
That's a good question. Folks, what do you think? Where are they going to get it? Well, there are still 2 problems that this new bill still does not fix though.
But before we address these 2 problems, which of these changes to the Social Security Administration, the Secure Act 2.0, or the at-home Medicare services? Which one will affect you the most? Do you think these services at home with Medicare will extend past 2024? We would love to read your thoughts in the comments below. Okay, problem number 1. While Medicare is extending some at-home services, Medicare still does not cover long-term care like in-home support services or assisted living. Also, long-term care insurance can be very expensive. So, do we really need long-term care insurance? And is it worth it? We are currently editing the video regarding this very issue and we'll share 3 hybrid options, so look out for it.
Problem number 2 is with the required minimum distributions. When there's a recession, like the one we're experiencing, and you are required to take a distribution every year, which is typically around 4%, how will this affect your retirement into your 80s or 90s, especially if you get hit with another recession during your retirement? If this is a concern or if you're curious, please click on this video here to learn more.